Good morning. Over the last week, COVID-19 cases have been stabilizing across much of the United States. In Iowa, new cases continue to decline and are now at levels we haven't seen since late August. A downward trend continues in the number of Iowans hospitalized with COVID-19. Statewide, they fell to 382 just a few days ago and stand at 408 now. That's 1,100 fewer people hospitalized now than in mid-November when we reached an all-time high of more than 1,500. Daily hospitalization admissions also continues to decrease, which could be attributed in part to more physicians and patients opting for the monoclonal antibody treatment following a COVID-19 diagnosis. Additionally, our long-term care facility outbreaks are down to 61, and new cases among residents and staff continue to decline. Iowa is making steady and positive progress in our COVID-19 response and recovery. But some skeptics suggest that maybe this is due to a decrease in testing, assuming that cases are dropping only because fewer Iowans are now choosing to be tested. However, our testing level now is consistent with that from October and early November, which was an all-time high at that point, until demand for testing rapidly rose to record levels during the height of the surge. So it's not surprising that it would return to a more stable level now, or that levels could fluctuate a little bit from week to week. But it's certainly not an indicator that the progress we're making is somehow less than what it seems. I believe we can attribute our progress to one thing, and that's Iowans. For months now, and especially since November, we experienced the very worst of the pandemic in our state. Iowans realized the seriousness of the situation and the importance of being a part of the solution to overcome it and sustain it. It isn't any one thing that we've done. It's all the different ways we've adjusted our behavior to keep the virus at a manageable level so that we can continue to live our lives as normally as possible. We've proven we can do it as long as everyone continues to exercise personal responsibility, and the progress you've made possible will continue as well. Yesterday, I had the opportunity to join governors from across the nation for what will be a weekly conference call with members of the Biden administration regarding the state of the pandemic and the plan to accelerate vaccination. Updates were given by Dr. Walensky, the new CDC director, General Panerna with the Department of Defense, and members of the White House COVID-19 response team. We did receive some positive news that the federal government will be increasing each state's vaccine allocation by 16% starting with next week's shipment. In Iowa, this should equate to an additional 6,300 doses, and they did say that that increased amount is guaranteed for the next 3 weeks. We were also informed that the new Johnson & Johnson vaccine is expected to receive emergency use authorization from the FDA next month. And this is a single-dose vaccine, and it will greatly simplify and speed up that vaccination process nationwide. Even with the positive news, and that is, I just still want to remind Iowans that the vaccine supply will still remain limited for quite some time. But despite that challenge, we are making good progress in our efforts to vaccinate as many Iowans as possible. Last week, when I announced the updates to Phase 1B, including the expansion of vaccine eligibility for adults age 65 and older, many counties that had already completed 1A vaccinations and had doses available had immediately moved into that next phase. So I want to thank those local public health departments and the vaccine providers for moving ahead. Even with the 16% increase starting next week, the nation's current vaccine supply simply cannot keep up with the incredibly high demand. And I know that that can be frustrating to hear. I know Iowans are very eager to get vaccinated and finally put COVID-19 behind them, and that time is coming, but we need to remain patient. It's really hard to believe that just 46 days ago, not a single dose of vaccine had even arrived in Iowa yet, just 46 days ago. But since then, more than 200,000 vaccines have been administered in Iowa, and Really, when you even put it into further context, that's just 9 months since Iowa first reported its first cases. It reminds me of a time not too long ago when we had to limit COVID-19 testing to a very small population of people because there weren't enough tests available nationwide. Then the supply chain began catching up to the demand, and we were able to get supplies through a public-private partnership and stand up the Test Iowa program less than 2 months after the first positive cases were identified in our state. So I think we'll continue to see that type of progress with the vaccination. And even since then, the number of testing providers has increased exponentially. Today, there are countless ways to be tested, including an over-the-counter test kit that you can complete yourself at home. Vaccines will follow a similar path as soon as manufacturing ramps up. More vaccines are approved and rolled out, and our state allocation increases even more so that we can get more supply to more providers statewide and into the arms of Iowans. One of the most highly anticipated vaccine milestones will be when every long-term care facility in the state has been vaccinated. Earlier this week, I spoke with leaders from CVS and Walgreens, the pharmacy partners that were hired by the federal government to manage the long-term program in Iowa and in states all across the country. Despite a slow start, they've assured me that the vaccine clinics are going well and remain on schedule. The first dose of vaccine has now been administered in nearly every long-term care facility in Iowa, and this first phase of vaccination for residents and staff will conclude at the end of this week. The second phase has already begun in some of the facilities, providing booster doses to those already vaccinated, as well as first doses for those who weren't vaccinated in the first round, and that phase is expected to end in late February. And then a third and final phase will ensure everyone vaccinated receives that second dose that got the first dose in the second round. Overall, the program is reporting that they've seen a 90% uptake of long-term care residents in Iowa. They're choosing to be vaccinated, which I think is extremely positive. The rate has been a little bit lower among staff during the first phase. That averages about 50%. However, when I talked to the pharmacy partners this week, they are seeing about a 30% increase in staff choosing to be vaccinated during the second phase, so we're seeing an uptick in that. The lower than expected uptake among staff has resulted in a growing unused supply of vaccine at both CVS and Walgreens. Since the federal government allocates vaccine for the program directly to the pharmacy partners, we're unable to reclaim it for use at the state level. However, in visiting with them and upon my request, both pharmacies have agreed to return the unused vaccine so it can be reallocated for state use. We're working on the logistics of that now with the CDC, and as soon as we receive the unused vaccine, it will immediately be distributed to providers to vaccine adults age 65 and up. You know, Iowans are asking many questions about the vaccination process, but nothing is more important to them than knowing when enough vaccine will be available and how they'll be able to get it. While the issues of how quickly vaccination can move ahead, it's because it is dependent upon supply. The good news is that there's no shortage of providers ready to administer it. In fact, pharmacists across the state, including those in rural communities, have been part of the vaccine planning process for months. The Community Pharmacy Enhanced Service Network, or CPESN Iowa, is a network of nearly 120 community pharmacies across the state. And their patient-centered approach, relationships with local healthcare providers, and strong ties to their communities make them an ideal partner to help advance vaccination efforts in every corner of our state. Today, I'm pleased to have with me Lindsay Ludwig. She is the Executive Director of CPESN Iowa. That is a mouthful, Lindsay, to share information about how this network is engaged in Iowa's vaccine strategy. So, Lindsay?
Thank you, Governor Reynolds. I am so happy to be here today representing the CPSN Iowa Community Pharmacy Network. And yes, that is a mouthful. Iowans may not know CPSN Iowa by name, but They do know and trust our network pharmacy members, caring for patients across the state from border to border, including many of the rural counties. In fact, these pharmacists are often one of the community's most accessible healthcare providers, and many of them have been preparing for and meeting regularly with their local public health officials over the past several months to coordinate vaccination administration plans. In December, local health departments in counties throughout Iowa, including those in Taylor, Hardin, Jasper, Jackson, Bramer, and many others, engaged local pharmacies to begin assisting with administering vaccines to their communities during Phase 1A. And in the past month, these pharmacists have vaccinated thousands of Iowans and have ensured that no doses have been wasted. As we all know, demand for vaccine appointments and information continues to increase daily, and vaccine supply to date has been very low. Iowans want to know where, when, how, and what to expect when receiving a COVID vaccine. Many Iowans are frustrated and anxious as they wait for the vaccine. Currently, our community pharmacies, along with local public health departments, clinics, and health systems, are navigating the challenge of receiving and responding to hundreds of daily phone calls and questions relating to COVID vaccine availability, the process to schedule an appointment, and when one might qualify. While as providers, we often have similar questions ourselves, pharmacies are regularly updating their phone messages, social media sites, and web pages to keep their patients and community as informed and educated as possible on the vaccine status in their county and in their pharmacy. Pharmacists in Iowa have been providing vaccines for over 20 years. As the vaccine rollout continues across the country and the state, and vaccine increases, local community pharmacies will serve as important access points for Iowans to receive that COVID vaccine. Our network of pharmacies will continue to work closely with local public health departments to ensure that all Iowans receive their vaccines as efficiently and safely as possible. Local community pharmacists are committed to serving the healthcare needs of Iowans close to home. Thank you again for this opportunity to speak today.
Thank you, Lindsay. I really appreciate it. And your network is truly an asset to the state of Iowa at this critical time. And I want to thank you and I want to thank your members for the work that you're doing every day to ensure that Iowans are vaccinated. And especially, as you said, border to border in some of our rural communities, it's just critical. And I know those relationships already exist, so we're really proud of the network and the partnership that we see taking place. So thank you. And now we're joined by one of those members to hear about his experience as a community pharmacist who is directly involved in the vaccination effort in his community. Ryan Freerichs owns and operates Meyer Pharmacy in Waverly and has worked as part of a team with local public health officials and others in Bremer County to ensure that they were ready to vaccinate community members as soon as the vaccine arrived. So thanks for joining me today, Ryan, and we look forward to hearing how you've allocated this in your community.
Thank you, Governor Reynolds. Here in Bremer County, we've had a very effective rollout to the vaccination effort. Weeks before the vaccine arrived, the Bremer County Health Department organized weekly Zoom calls with all the pharmacies, provider clinics, and hospitals in our county. Our local public health director, Lindley Sharp, would open the meeting by relaying any updates she received from the state, and if there was any vaccine coming to our county that week. Then, as a group, we would discuss who had capacity and or existing relationships with the target populations. And our local health department would disseminate the vaccine based on that feedback. Within 24 hours of receiving the vaccine, Meyer Pharmacy began vaccinating Phase 1A eligible citizens. In the first weeks, we worked through a diverse set of Phase 1A groups: 8 local EMS ambulance crews, pharmacy staff, a local behavioral health clinic, some local physical therapy, dental, and optometry practices, hospice and dialysis nursing staff, and caregivers at a children's residential treatment facility. This required much coordination and scheduling, as this vaccine has unique storage requirements and a short 6-hour shelf life from the first shot administered. It took a village here to create the appointments, institute contactless consent forms, vaccinate folks safely, and allow for a 15-minute post-vaccination observation time. But our dedicated staff was up to the task. Even with these diverse target populations, we administered these doses within a week of receiving them, all the while continuing to serve our essential pharmacy operation. There is no doubt it has been a challenge and will continue to be a challenge for the entire healthcare system, which was already busy prior to this major effort. What we've been able to accomplish in Bremer County has been a result of early team coordinated effort by the public health and utilizing existing healthcare providers. In Bremer County, we are suggesting citizens to work with a healthcare provider that they have an existing relationship with, whether that be a physician, pharmacy, nurse practitioner, or others. We feel this will be the most efficient means to vaccinating our communities. At Meyer Pharmacy, we will work from our own files to contact our patients by phone when we have vaccine for them. We know who you are, we know you want the vaccine, we simply don't have enough for everyone at this moment. Our challenge is preparing a plan for receiving 50 doses of vaccine or 1,000 doses of vaccine. I've seen firsthand how eager Iowans are for the vaccine. I've seen people cry tears of joy when they receive it. I can assure you our staff, like many others, will adapt and respond to deliver that vaccine quickly and safely when we receive it. All Iowans that want the vaccine will receive it. We appreciate and request your continued patience as we tirelessly work through the logistics and distribution. Community pharmacies are poised to make a significant impact and be part of that vaccine solution. Thank you.
Oh, thank you, Ryan. I just so greatly appreciate you and everyone on the team that you're working with to serve your community, and it is a team. The partnership, the coordination is second to none. So please give everyone my very best and tell them how much we appreciate all the work that they're doing to get Iowans vaccinated. So thank you very much. So as we continue to update and make information available later this week, vaccine data will be added to a new dashboard at the coronavirus.iowa.gov so that Iowans can see for themselves the progress that we're making every day. The vaccine dashboard will include the numbers of first and second doses administered, the number of doses by manufacturer, and the number of doses by day. It will also include totals by county, gender, age, race, ethnicity. And to help Iowans find a vaccine provider near them, an interactive map will display providers by county. So you will click on a county where you live or work, and a provider provider locations will be listed. Then you'll be able to simply click to connect to their website and schedule an appointment to get more information. So as with other COVID-19 data available on the website, updates and enhancements will be made to the dashboard when additional information becomes available. And with that, we'll go ahead and take your questions.
Governor, do you have authority in your healthcare proclamation to make more health professionals eligible to deliver the vaccine, like dentists?
So they have that flexibility now, and I think that's covered in the shortage order. But Kelly, do you want to give some insight on that? Did you hear the question?
I believe there's legislation. Yes, ma'am. I believe there's legislation, Governor, that would give dentists the flexibility currently under consideration by the legislature.
And I think actually some of the rural communities, when they finished their 1A allocation, moved out to other professionals that were patient-facing. I think one of the speakers that we had on early on when we were rolling out the vaccine had done that. So I'll take a look at that, Kay, and see what that legislation is and see how we can move through that. What we did is we took the recommendations from IDEC, we took what we were hearing as far as changes from the CDC, and where most states were moving to 65 and up, long-term care facilities, of course, healthcare professionals, and then to look at ways we could tier that based on recommendations to continue to build that out.
communication here. I'm
Oh, I'm
talking
sorry.
about having dentists give the shots.
Okay. Yeah, that is
Sorry.
communication. I heard a completely different thing. Sorry, Kelly.
And that's what she was addressing.
That's what she answered to you. I thought you were talking about
But
receiving
do
the
you
vaccine.
think you would have authority to let other healthcare professionals through a proclamation?
I think we can through the health declaration. I think we've been able to do that. And there, as Kelly indicated, there's legislation addressing that too. So it's something that we'll continue to look at if there's a need to expand the scope. And I'm sorry, I just completely misunderstood what you were asking.
Governor, should the acceptance of the vaccine be made a condition of employment at the state-run care facilities? And do you plan to disclose the rates of refusal at Iowa's privately run care facilities?
Kelly, do you want to take that?
I certainly can. Right now, we are not making it a condition of employment, and that really is to give everyone an opportunity to make the choice. We worked with our legal counsel over the summer contemplating this decision. It's one that I think all employers are having to face. We have other ways that we will certainly incent individuals taking it in our state-operated facilities, and we are very much posting all of that information online, so you can see very clearly what our acceptance rate looks like. Education is really key to this. We want to make sure our employees feel comfortable and have all of the material available at their fingertips to make a decision that's best for them. And I think we wait, we see exactly what this looks like for our facilities. Of course, safety for our residents and our employees is always at the forefront of our minds. And we'll consider what options look like moving forward once we have those data points.
Governor, there's some concern, including by some members of the IDAC Council, that by opening vaccinations to everyone 65 and older, when there's not nearly enough vaccine to cover them all yet, that you're going to leave behind some older Iowans who don't have good access to the internet, don't have someone to make a bunch of phone calls for them trying to find an appointment, and that they're going to wind up waiting a long time to get a vaccine. What do you say to
We have
that?
local public health that are doing outreach with communities. We've talked with Kelly's team about putting in place navigators, much like we did when we were talking about signing up for insurance options. And, really, I appreciate all the work from the IDAC committee and the recommendations that they made, the expertise that they brought to the table, and the time that they spent on that. But data changes, and the recommendations from the CDC and most of the states are moving to a 65-year and plus age group to move them into the top priority. And I agree with that, and I think that that was the right thing to do. I've made it very clear to Iowans, it's based on the supply that we receive, and right now the demand exceeds the supply. On the call yesterday, they reiterated that they appreciated the states, the administration appreciated the states that were moving to the 65 plus, so they agreed with that. They believed that that was the right thing to do. And they're going to do, as the manufacturers continue to enhance their processes and they feel comfortable that they'll be able to manufacture and can have that second dose available. They are hopeful that the number of vaccines that we receive will continue to increase. I mentioned Johnson & Johnson hopefully coming on board next month. That's a single dose. That'll help with the allocation process. So I'm asking Iowans to be patient. We're limited to the number of vaccines that we get, but I feel comfortable with the way that we have laid it out, the tiers that we've put in place, the education and the allocation, working with not only our providers, but working with our local public health, our hospitals and our clinics. We're going to continue to move forward, and we'll keep the public engaged.
Governor, with the extra vaccines coming, just to clarify the first part, this is not, I've seen elsewhere where some are trying to have to get those higher efficiency syringes to pull out a sixth dose from the vial that has 5.
Yep.
This is not that, right?
No.
This is extra stuff.
But that is 16% new doses. What they also talked about yesterday, and it's already I think it's included in our allocation, in our numbers already, Kelly, but they are sending out the supplies to ensure that we can get that 6th dose out of the vials. So that will go in next week's shipment as well, but they were very clear to reiterate over and over that that was not included in the additional 16% that each of the states would be allocated. So that is on top of that, and they are sending the supplies that we need to accurately do that as we move forward.
And if my math is right, if we go from 19.5 and add 6,300 extra, we're up to 25.8.
Yeah.
So starting next week.
And
What-
we've heard that verbally. I'm looking at Kelly, so Kelly, keep nodding. We've heard that verbally. We're just waiting to see that in writing, but that'll go in Thursday's order. But we have received that verbally. We're hoping to have that confirmed today, and then that will be available next week. And as I mentioned, we're working with CVS and Walgreens to really redistribute some of the unallocated vaccines that they have. I'm very grateful that they are willing to do that, and that will help us disseminate to 65-year and plus. That was brought up on the call yesterday with the governors as well, that had been requested by several governors because it's been slow to roll out and the uptake and, let's get the vaccine out. And so they assured us that they were moving in that direction. So this is we want to just confirm with CDC that call is set up today. And we're hoping, I don't want to overcommit, but we're hoping even by this week we'll be able to allocate some of those, if not probably next.
What do you think we can handle in our infrastructure?
Well, we're ready to go. Now, Kelly, I think, the strike teams, we're still working on that, but Hy-Vee is working and reaching out to some of our manufacturing plants, so they also, and some of our pharmacy partners can help facilitate the strike teams working with the various businesses. Our state Iowa Department of Public Health is working on 6 additional strike teams, so we're working on the logistics with that. The community pharmacies that you just heard from, they're in communities all across the state, so they're ready to go. Hy-Vee, Medicap, I think we have a lot of, the logistics are in place, Kelly. It's just a matter of getting the vaccine. I think we're ready, to administer. It's a number problem right now.
And Governor, how do this 16% increase, does that play into the February 8th increase we're expecting of the roughly 19?
That will be on top of the 16, right? Because that's when we've finished what's being allocated to the long-term care facilities, and then those will roll into the state's allocation, and we're anticipating that on February 8th. Yeah.
Governor, can you respond to reports that your office has given preferential treatment to some companies that are tied to campaign donors?
Yeah.
That's out there, and the auditor said he's going to investigate. I just wonder if you could respond to
well,
that.
Listen, I want to tell you, thank goodness that when we're setting up these programs and when we're putting those grant programs in place, we're basing it on metrics and criteria. And those programs, before they ever roll out, we take the recommendation from agencies, from Debbie Durham's team, the Department of Revenue, our state economist, the Secretary of Ag, Director Townsend, Kelly Garcia. So they put the statistics, the criteria together, and then we roll out the program. And if you qualify, you qualify. So it's that simple. In addition to that, if we're talking about some of the funding that went through the ag dollars, the federal ag dollars that went out, that was a really tough time. And I know my team, and I know was on the phone daily reaching out to businesses, to manufacturers. We were reaching out to long-term care facilities. We did a weekly webinar with businesses and long-term care facilities all across the state to make sure that they knew that we have this process in place. We can do strike teams. We can come into your facility. We can work with your team if you have somebody to administer the vaccine, or we can bring them in, or we had the option, because we were one of the few states that had vaccines, we could actually set up a Test Iowa site and facilitate with the manufacturing company as well. To my knowledge, I verified again this morning, there wasn't one company that requested that we weren't able to meet that request. We were able to work with over 60 companies at a time when we had processing plants shutting down. We had our hog stock backing up. We were looking, based on an Iowa State economist numbers, we were looking at potentially euthanizing over 500,000 market weight hogs. They average anywhere from 250 to 300 pounds, but because we were daily and weekly working with manufacturers, anybody that's in the the food supply chain, to help test, to help make sure that we were, identifying who was positive, who was negative, and doing everything we could to keep the facility open, and most importantly, the employees safe. Those numbers were much less than was anticipated. We're the largest hog producer in the country. We produce a lot of hogs. It was based on the hogs that had to be depopulated, and and we can get you the criteria to qualify for that. It was based on the weight, and it didn't really cover the cost of disposal, let alone the cost that they had tied up in the hogs.
Thank you. I think the assertion was, though, that there were some smaller companies that were moved
I
kind of
just
ahead
said
in
to you,
testing,
it's unjustified.
Okay.
Any company that requested, calls were coming in, calls were going out. We were setting up webinars. Secretary Nag was reaching out to companies. I mean, this is when we had processing plants shutting down. 10% of the nation's food supply is attributed to our farmers and producers, and it was critical that we did this in a safe and responsible manner so that we could keep food on the shelves and we could keep families fed. And so, around the clock, we were reaching out and making contact, and those were coming in. Companies were reaching out to Secretary Nag, help us. It was across the board. So, and that's the same thing is happening with vaccines. It's not anything different. We have to take a look at what we can do to keep the food supply chain moving and to keep these companies open. It has nothing to do with the other. There's criteria. You qualify. To my knowledge, nobody was told no. And so if you called and wanted to try to facilitate a way to get your employees tested so that you could ensure them that they were working in a safe environment, that's what companies were doing, and we were doing everything that we could to help facilitate that, and I will make no apologies for doing that. None.